Hi, my name is Dr. Kline Lim, and I'll be teaching you the world of weird corned beefs, crispy bacons, juicy tapas, and meaty meatloaves. I leave that to your imagination. Welcome to the introduction of gross anatomy. Let's begin. Gross anatomy deals with the structures of the body that are visible to the naked eye. Structures such as the muscles, the bones, digestive organs, or the skin can be examined by means of cadaveric dissection. Cadaver means a dead body. Dissection means to cut apart. Oh, and one more thing. If you think these pictures are gross, then you are definitely in the right class. Gross anatomy comes in two portions, clinical anatomy and basic anatomy. Clinical anatomy is the study of the macroscopic structures and functions of the body as it relates to the practice of medicine and other health sciences. And basic anatomy is a study of the minimal amount of anatomy consistent with the understanding of the overall structure and function of the body. There are different descriptive anatomic terms that we have to discuss, and these are the following. The Vitruvian Man is a drawing made by the Italian Leonardo da Vinci in about 1419. The drawing, which is in ink on paper, and represents ideal human body proportions. And this is also said to be the origin of the anatomic position. All descriptions of the human body are based on the assumption that the person is standing erect, with the upper limbs by the sides, and the face and palms of the hands directed forward. This is called the anatomic position. The various parts of the body are described in relation to the certain imaginary planes, and the following are the directional terms you should know. I want you to watch the next video about the anatomic position.
Anatomical directional terms. A directional language of anatomy exists in order to minimize confusion when discussing areas or specific points on the body. This directional language or terminology is used in reference to the anatomical position. The anatomical position is when a person stands erect, face pointing forward, arms at the sides, palms facing forward, and feet also pointing forward. If everyone is looking at the body in the exact same position, there will be less confusion when discussing anything related to anatomy. We're going to start with superior and inferior. Superior means toward the head, but it can also mean upper or above. Inferior means toward the feet, but it can also mean lower or below. So we would say that the heart is located superior to the small intestine, or we could say the small intestine is located inferior to the heart. Next is anterior and posterior. Anterior means further to the front or in front of. Posterior means further to the back or in back of. So we would say the sternum is anterior to the heart, and the heart is posterior to the sternum. Sometimes the terms ventral and dorsal are used in place of anterior and posterior, where ventral means anterior and dorsal means posterior. Anterior and posterior can also be used to describe how you're looking at the body. While the body will always be referenced from the anatomical position, it can be viewed from an anterior view, meaning looking at the body from the front, and it can also be viewed from the posterior view, meaning looking at it from the back. Medial and lateral are another set of directional terms. Medial means toward the midline of the body, and lateral means toward the side of the body, or away from the midline of the body, where the midline is an imaginary line that divides the body into left and right halves. So we would say that the heart lies medial to the lungs, or you could say that the lungs lie lateral to the heart. Lateral can also be used to describe how you're looking at the body. While the body will always be referenced from the anatomical position, it can be viewed from the lateral view, meaning looking at the body from the side. Next is proximal and distal. Proximal and distal are terms that are usually used when describing parts of the appendicular body. Remember that the axial body consists of the head, neck, and trunk, and the appendicular body consists of the limbs, or appendages that are added to the axial body. Proximal means closer to the axial body, or toward the trunk of the body, and distal means further from the axial body, or further from the trunk of the body. So we would say the thigh is proximal to the foot, or you could say the foot is distal to the thigh. Superficial and deep are another set of directional terms. Superficial means closer to the surface of the body, and deep means further away from the surface of the body. So we would say the sternum is superficial to the lungs, or the lungs are deep to the sternum. Remember, this is the case when we're looking at the body from the front or anterior view, when it's in the anatomical position. And that be the anatomical directional terms.
For clarifications, the sagittal plane is also known as median plane or the medial sagittal plane, the one that was described as a vertical plane passing through the center of the body, dividing it into equal right and left halves. Remember the mnemonics SSS, sagittal, side by side, or you can also think of a Sagittarius, an archer, and how the archer holds a bow in a sagittal plane. So if we go back to this man here, the ones pointed by the arrows are medially located, the medial portion of your upper and lower extremities. If you have also noticed, even in different positions, the anatomic term is still the same. The ones pointed by the arrows are laterally located, the lateral portions of your upper and lower extremities. So once again, even in different positions, the anatomic term is still the same. The coronal plane divides the body into front and back. You can remember it by thinking of a tiara-style crown or a corona, which is heavily decorated on the front and bare in the back. The transverse plane is also known as a horizontal plane. It is perpendicular to the long axis of the body and parallel to the ground. This divides the body into superior and inferior aspects, like this carrot being cut through its horizontal plane. If you know Bisaya and you always get confused between horizontal and vertical, this mnemonic might help you. Vertical is barug, which comes from the Visayan term barug, which means to stand up, and higda for horizontal, a Visayan word which means to lie down. So in this sense, horizontal plane will divide the body into superior and inferior aspect, while vertical plane divides the body into right and left halves. Some additional terms. The term superficial and deep denotes the relative distances of the structures from the surface. So let's use a pork chop as a reference to help you remember. The skin is superficially located than the muscle, and you can say that the muscle is deeper than the skin. The terms internal and external are used to describe the relative distance of a structure from the center of an organ or a cavity. So for example, the internal carotid artery is found inside the cranial cavity, and the external carotid artery is found outside the cranial cavity. To define laterality, we will be using the following terms. The term unilateral denotes one side of a specific part of the body is involved, while bilateral denotes affecting both sides of the body. Example, the right foot and the left foot are bilateral. The term ipsilateral refers to the same side of the body. For example, the left hand and the left foot are ipsilateral. Contralateral refers to the opposite sides of the body. For example, the left biceps brachii muscle and the right rectus femoris muscle are contralateral. The supine position of the body is lying on the back, and the prone position is lying face downward. Right and left lateral recumbent, which means that the patient is lying on their right or left side. The Fowler's position is that a person is sitting straight up or leaning slightly back, and their legs may either be straight or bent. Trendelenburg position is that a person is lying supine with their head slightly lower than their feet. Please remember these terms as we use a lot of them or a lot of these in the study of gross anatomy as well as in physical therapy. For the terms related to movement, there is a video I want you to watch.
The human body is rarely static, and its component parts, especially in the limbs, are dynamic entities. Anatomical language, therefore, has a special set of terms to denote direction of movement of the various body parts. In the upper limb, flexion denotes a forward movement of the whole limb or any part of the limb. Conversely, backward movement of the limb or any part of the limb is referred to as extension. When the upper limb is moved away from the vertical midline axis of the body, that movement is referred to as abduction, and movement of the limb towards the midline axis of the body denotes adduction. In certain joints, there is so much versatility of movement that the individual parts can be moved about several different axes. Such multi-axial joints, best exemplified by the shoulder joint. The shoulder joint is so versatile that not only is it capable of flexion and extension and abduction and adduction, but it is also capable of so-called internal rotation and external rotation. Internal rotation is also known synonymously as medial rotation and external rotation as lateral rotation. Internal rotation and external rotation at the shoulder joint can be demonstrated not only with the arm in the neutral position, i.e. by the side of the body, but also with the arm in abduction. This, with the arm in abduction, is external rotation, and this is internal rotation. A sequential combination of all of these movements in the shoulder joint is referred to as circumduction. Moving distally down the limb, you will observe that the forearm is capable of specialized rotatory movements. An inward rotation of the forearm is referred to as pronation, and returning to the forearm to the original position constitutes supination. If you should have any difficulty in remembering which is supination and which pronation, simply remember the position of the thumb in each of these movements. In supination, thumbs up, S for super, and in pronation, thumbs down, P for pants. Easy. Moving further down the limb, at the wrist joint, the movements possible are a forward movement of the wrist joint, which is flexion, a backward movement of the wrist joint, which is extension, and in addition to flexion and extension, the wrist joint can also be deviated laterally, which is called lateral or radial deviation or abduction, or it can be moved in, which is ulnar deviation or adduction. In the hand, the fingers are capable of flexion, which is a forward bending of the fingers, and straightening of the fingers, which is extension. In addition to flexion and extension, it is also possible to move the fingers apart. This constitutes abduction of the fingers. An abduction of the fingers always relates to the long axis of the metacarpal bone of the middle finger. Thus, movement away from the long axis of the middle finger metacarpal bone constitutes abduction. And when the fingers are brought together, which is to say brought towards the long axis of the middle finger metacarpal bone, that movement constitutes adduction. The thumb is the most flexible and versatile of the digits. It's capable of flexion, extension, abduction, adduction, and also a rotatory movement whereby the pulp of the thumb can be made to face the pulps of the other fingers. And this inward rotatory movement of the thumb is referred to as opposition. The movements at the hip joint are flexion, reflected in the forward movement of the thigh, extension, reflected in the backward movement of the thigh, abduction, when the thigh is moved outward, away from the median axis of the body, and adduction of the hip joint, reflected in the inward movement of the thigh. In addition to these four basic movements, the hip joint is also capable of internal rotation and external rotation. And either of these movements at the hip joint can be accomplished either with the limb straight or with the knee flexed. A sequential combination of all of these movements at the hip joint constitutes circumduction of the hip. Moving further down the limb, the knee joint is a modified hinge joint, and the principal movements at the knee joint are flexion and extension. Now here, extension of the knee joint is manifest as a forward movement of the leg. And this apparent contradiction is explained by the rotation of the lower limb that happens during embryological development, so that the back of the leg is in fact the flexor surface of the leg, and the front of the leg the extensor surface of the leg. Contrast this with the upper limb. Now, moving further down the lower limb, we come to the ankle joint, which is a uniaxial or hinge joint. The movements possible at the ankle joint are extension and flexion. Extension at the ankle joint, which is manifest as an upward movement of the foot, is also referred to as dorsiflexion. And flexion of the ankle joint, manifest as a downward movement of the foot, is referred to as plantar flexion. Moving further along, various small joints in the foot allow specialized movements of the foot. An inward rotation of the foot, whereby the medial border of the foot is elevated relative to the lateral border of the foot, is referred to as inversion of the foot. And the opposite movement, wherein the lateral border of the foot is elevated relative to the medial border of the foot, constitutes eversion. And finally, the toes are capable of flexion and extension. And to a considerable extent, although not as impressively as in the hand, the toes are also capable of abduction and adduction. However, in the foot, abduction and adduction of the toes is related to the long axis of the metatarsal of the second toe.
So let's take a break. Break muna kayo, mga 10 to 15 minutes lang. Umihi, maligo, kumain, mag-stretching, or umutot. Pwede naman. Pero baliki ko, ayaw pag-procrastinate. Pop quiz. Anong section to? Section A or section B? Joke. Corny, no? So, what's your answer? So, the answer is sagittal section. Why? Because it divided the head into right and left halves. Nakikita nyo yung brain, di ba? Dok, bakit section at hindi plane yung ginagamit, Dok? We are calling it section instead of plane because section refers to the side where a plane physically cuts. A plane is an imaginary line, while a section is something you can see with your naked eye that was already dissected. But take note that you can use both terms interchangeably and it is still acceptable. Okay? Right, we go to the next slide. So the following are different examples of planes that are cut through the body. So the first one is a sagittal section of the head, which I just showed you in the pop quiz. The second one is a transverse section through the abdomen, where you can see the liver, the kidneys, and the spinal cord. Then the last, but not the least, is a frontal section through the right hip. So you can see here the femur, the acetabulum, and the thigh muscles. So here we're going to talk about the basic structures of gross anatomy from the skin to the blood vessels. The outermost layer of the body is known as the skin. It is said to be the largest organ in the body, but please take note the largest and solid internal organ in the body is the liver. The skin is our largest organ, and adults usually carry around 8 pounds or 3.6 kilograms, and also actually make up 22 square feet or 2 square meters of it. According to Snell, the skin is divided into two parts. Dok, 3 layers yung nakikita ko sa screen. Wait lang, I will explain. The superficial part is known as the epidermis, and the deep part is known as the dermis. The dermis of the skin is connected by a thin tissue to the underlying deep fascia or bones by the superficial fascia, otherwise known as the subcutaneous tissue. In other references, the subcutaneous tissue is a third layer of the skin called the hypodermis, from the Greek term below the skin, or also known as superficial fascia. For the purpose of this lecture, we will use Snell. The epidermis is a stratified epithelium whose cells become flattened as they mature and rise to the surface. On the palms of the hands and the soles of the feet, the epidermis is extremely thick. This is to withstand the wear and the tear that occurs in these regions. In other areas of the body, for example, on the anterior surface of the arm and forearm, as well as the skin on your eyelids, are thin. A callus or kubal in Bisaya is a thickened and hardened part of the skin or soft tissue, especially in an area that has been subjected to friction. Boys, ingat, basi magkakalos na. But on a serious note, if you have any lumps in your private areas, please don't hesitate to contact your doctor. Alright, next. The dermis is composed of dense connective tissue containing many blood vessels, lymphatic vessels, and nerves. It shows considerable variations in thickness in different parts of the body, tending to be thinner on the anterior than on the posterior side, and it is thinner in women than in men. So these are the different skin appendages that we have. We have the nails, the hair follicles, the sebaceous glands, and the sweat glands. We will be discussing them one by one. The nails are keratinized plates on the dorsal surface of the tips of the fingers and toes. The proximal edge of the plate is the roof of the nail. With the exception of the distal edge of the plate, the nail is surrounded and overlapped by folds of skin known as the nail folds. The surface of the skin covered by the nail is the nail bed. Hair grows out of follicles, which are invaginations of the epidermis into the dermis, and the follicles lie obliquely to the skin surface, and their expanded extremities are called the hair bulbs. They penetrate to the deeper part of the dermis, and each hair bulb is concave at its end, and the concavity is occupied by vascular connective tissue called hair papilla. A band of smooth muscle, the erector pili, connects the undersurface of the follicle to the superficial part of the dermis. The muscle is innervated by sympathetic nerve fibers, and its contraction causes the hair to move into a more vertical position. It also compresses the sebaceous gland and causes it to extrude some of its secretions. The pull of the muscles, or the muscle, also causes dimpling of the skin surfaces called goose flesh. Hairs are distributed in various numbers over the whole surface of the body, except on the lips, the palms of the hands, the side of the fingers, the glans penis, and the clitoris. Also the labia minora, and the internal surface of the labia majora, and the soles of the sides of the feet and the sides of the toes. Sebaceous glands pour their secretions, the sebum, onto the shaft of the hairs as they pass through the necks of the follicles. They are situated on the sloping undersurface of the follicles and lie within the dermis. The sebum is an oily material that helps preserve the flexibility of emerging hair. It also oils the surface epidermis around the mouth of the follicle. Sweat glands are long, spiral, tubular glands distributed over the surface of the body, except on the red margins of the lips, the nail beds, and the glans penis and the clitoris. These glands extend through the full thickness of the dermis, and their extremities may lie in the superficial fascia. The sweat glands are therefore the most deep penetrating structures of all the epidermal appendages. The fascia, the plastic bag of the body. Why? Because it functions to keep the body structures in place and separates one structure to the next. The fascia of the body can be divided into two types, the superficial and the deep fascia. They lie in between the skin and the underlying muscles and bones. An important function of the muscle fascia is to reduce friction of muscular force. In doing so, fascia provides a supportive and movable wrapping for nerves and blood vessels as they pass through and between the muscles. See, plastic. The superficial fascia or subcutaneous tissue is a mixture of loose areolar and adipose tissue that unites the dermis of the skin to the underlying deep fascia. If you take a look at the gross picture, the superficial fascia has no clear demarcations, but the yellow structures you see are the loose areolar and adipose tissues. For short, doc, it's fat. The answer to that question is a yes and a no. Yes, because majority of this fascia is made out of fat, but no, because there exists a very thin layer of tissue. In the scalp, the back of the neck, the palm of the hands, and the soles of the feet, it contains numerous bundles of collagen fibers that hold the skin firmly to the deeper structures. In the eyelids, auricle of the ear, the penis and the scrotum, and also the clitoris, it is devoid of adipose tissue, obviously. The deep fascia is a membranous layer of connective tissue that invests the muscles and other deep structures. So in this picture, it looks like a shiny plastic, or if it helps, the skin of a longanisa. This is a transverse section of the neck, and the colored lines are the different fascias of the neck you'll get to know later on. Yay! In the neck, it forms well-defined layers that may play an important role in determining the path taken by pathogenic organisms during the spread of an infection. You will learn the next topics how important the fascia in the neck will be. In the thorax and abdomen, it is merely a thin film of areolar tissue covering the muscles and aponeurosis. In the limbs, it forms a definite sheath around the muscles and other structures holding them in place. Fibrosepta extend from the deeper surface of the membrane into compartments. In the region of joints, the deep fascia may be considerably thickened to form restraining bands called retinacula, and their function is to hold underlying tendons in position or to serve as pulleys around the tendon so that it may move. How many muscles do you think are in the body? 200, 800, 100, 1000? Now 1000 is just too much. If we have that many, then we may be able to do a lot more dance moves and do interesting positions. Now there are approximately 650 muscles, and you all need to memorize each of the origin, insertion, innervation, action, as well as the blood supply of each. Welcome to physical therapy. But it's not part of this topic yet, but it will soon arrive. Anyhow, there are three types of muscles in the body, and those are the skeletal, smooth, and cardiac muscles. So we're going to discuss first the smooth and the cardiac muscles because the skeletal muscle is the star of the show. All three of them are important, of course. You need the cardiac muscle to keep you alive, and the smooth muscle to digest that lechon or crispy pata you just ate. But the skeletal muscle has a lot of things we have to discuss. So we go first with smooth muscle. So this is a type of muscle tissue which is used by various systems to apply pressure to vessels and organs. The smooth muscle is composed of sheets or strands of smooth muscle cells consisting of long, spindle-shaped cells closely arranged in bundles or sheets. In the tubes of the body, like the esophagus, it provides the motive power for the propelling of the contents through the lumen. This method of propulsion is called or referred to as peristalsis. The cardiac muscle consists of striated muscle fibers that branch and unite with each other. Close sila. It forms the myocardium of the heart, which is the muscular tissue of the heart. Its fibers tend to arrange in whorls and spirals, and they have the property of spontaneous and rhythmic contractions. So there are specialized cardiac muscle fibers form the conducting system of the heart. The skeletal muscles, here we are. The skeletal muscle produce the movements of the skeleton, obviously. They are sometimes called voluntary muscles and are made of stripped muscle fibers. A skeletal muscle has two or more attachments, and the attachment that moves the least is referred to as the origin, and the one that moves the most is the insertion. Take a look at the video below. Always remember that muscle move from insertion to origin. Remember this concept so that it will be easy for you to memorize and remember the different origins and insertions of the muscles. The fleshy part of the muscle is referred to as its belly, and the end of the muscle are attached to bones, cartilage, or ligaments by cords of fibrous tissue called tendons. Occasionally, flattened muscles are attached by a thin but strong sheet of fibrous tissue called aponeurosis. An araphe is an interdigitation of the tendinous ends of fibers of flat muscles. Muscles whose fibers run obliquely to the line of pull are referred to as pennate muscles because they resemble a feather. There are three types of pennate muscles. A unipennate muscle is one in which a tendon lies along one side of the muscle and the muscle fiber passes obliquely to it. And an example would be your extensor digitorum longus. A bipennate muscle is one in which a tendon lies in the center of the muscle and the muscle fiber pass to it from two sides. Example would be your rectus femoris. A multipennate muscle may be arranged as a series of bipennate muscles lying alongside one another. An example would be your acromial fibers of the deltoid, or may have the tendon lying within its center and the muscle fibers passing to it from all sides, converging as they go. This is an example would be tibialis anterior. So these are common examples of your muscles. You have convergent, we have a circular, multipennate, fusiform, bipennate, unipennate, and parallel. Dok, wait lang. Ang rami na. Remember, introduction pa ni. Ginusto mo to, panindigan mo. So you know that skeletal muscles makes us reach for that cup of coffee every morning. Each muscle that makes you put that coffee in your mouth has a role. Number 1, a prime mover, or also known as agonist. The muscle that contracts to bring about a movement. For example, to put that coffee in your mouth. An antagonist is the muscle that relaxes as the prime mover contracts. A fixator is a muscle that contracts statically to fix parts of the body in order to maintain a correct or stable position. And synergists are the other muscles that assist the prime mover. Oh, Dok, may ganun pala. Yes, let me explain. To put that cup of coffee in your mouth, the brachialis, which is the primary flexor of the elbow, is activated, and thus is the prime mover for this action. The biceps brachii assists in elbow flexion, so alalay lang si biceps brachii. The triceps brachii, which is located posterior to the arm, relaxes to allow the smooth flexion of the elbow, and the rhomboids and the deltoids stabilizes your arm so that the cup of hot coffee would safely reach your mouth. Alright, so we'll talk about the nerve supply. So the nerve trunk to a muscle is a mixed nerve. About 60% is motor and 40% is sensory. And it is also contains some sympathetic autonomic fibers. The nerve enters the muscle at about the midpoint on its deep surface, often near the margin. The place of entrance is known as the motor point. This arrangement allows the muscle to move with minimum interference with the nerve trunk. Naming of skeletal muscles. Individual muscles are named according to the shape, the size, the number of heads or bellies, position, depth, attachment, or action. Alright, so here is a nomenclature of how a muscle is named. With regards to shape, the deltoids look like triangles. The teres major and minor looks round, and the rectus is straight. The broadest is coined as the latissimus, or latissimus dorsi in this case, while the longest is termed as longissimus. Biceps, triceps, and quadriceps have 2, 3, and 4 heads or bellies respectively. The pectoralis, which is the chest muscle, and gyn rats often call it pecs. An example of attachment is a sternocleidomastoid, which comes from the sternum and clavicle to attach to the mastoid process, and so on and so forth. This will guide you when you study the muscles later on. So another break, 10 to 15 minutes. Alright, so pop quiz again. So what do you think is the prime mover and the antagonist of letter A? So letter A is actually knee extension, correct? So quadriceps femoris extending the knee as a prime mover and biceps femoris acting as an antagonist. What about letter B? So this is actually knee flexion. Biceps femoris flexing the knee as a prime mover and quadriceps acting as an antagonist. How about letter C? So the C is a muscle or muscles around shoulder girdle, fixing the scapula so that the movement of the abduction can take place at the shoulder joint. And letter D, flexor and extensor muscles of the carpus acting as synergists and stabilizing the carpus so that long flexor and extensor tendons can flex and extend the fingers. So joints. How many joints are in the body? I'll just go straight to the point. There are 187 joints, and you'll be all acquainted to them in the nearest future. Classify joints by what they are made of and what they do. Because form follows function, we can't really talk about one without talking about the other. We will first discuss the structural classification. Structural classification focuses on what kind of materials bind those bones together. We have three parts, or three types. We have fibrous joints, cartilaginous joints, and synovial joints. Fibrous joints occur where bones are held together by dense, regular, or fibrous connective tissue. Thus, very little movement is possible, like the sutures found in the skull and gomphosis which are found in your teeth. So cartilaginous joints occur where bones are joined by cartilage. Primary cartilaginous joints, or also known as synchondrosis, are bones that are connected by hyaline cartilage and provides no movement. The epiphyseal cartilage of long developing bones and the joints between the first rib and the manubrium sternum are example of such a joint. The secondary cartilaginous joint, also known as symphysis, where bones are connected by white fibrocartilage, allows limited movement. And a sample of a secondary cartilaginous joint is between the vertebral bodies and the symphysis pubis. The joint that makes you do yoga, do sports, and the art of breakdancing possible are the freely movable synovial joint. And most joints in your body are made of this type of joint. They contain a viscous white fluid that acts like a grease on a hinge. Without that lubricant, just running down the street can cause enough friction not only to wear it out, but may overheat your joints and essentially look soaks or cooks the surrounding tissue and leave your legs smoking like Roadrunner in Looney Tunes. This freely movable synovial joint comes in 6 different configurations that together allows you to do pretty much any movement your body can make. For the plain type of synovial joint, the opposed particular surfaces are flat or almost flat, and this permits the bone to slide on one another. So an example would be the sternoclavicular and the acromioclavicular joints. Hinge joints resemble the hinge on the door so that flexion and extension movements are possible. Examples of the joints are the elbow, the knee, and the ankle joints. Condyloid joints have 2 distinct convex surfaces that articulate with 2 concave surfaces. The movement of flexion, extension, abduction, and adduction are possible together with a small amount of rotation. And the metacarpophalangeal joints or the knuckle joints are good examples. In pivot joints, a central bony pivot is surrounded by a bony ligamentous ring, and rotation is the only possible movement. The atlantoaxial and superior radioulnar joints are good examples. In ball and socket joints, a ball-shaped head of one bone fits into a socket-like concavity of the other. This arrangement permits free movements, including flexion, extension, abduction, adduction, medial rotation, lateral rotation, and circumduction. The shoulder and hip joints are good examples of this type of joint. In saddle joints, the articular surfaces are reciprocally concavo-convex and resemble a saddle on a horse's back. These joints permit flexion, extension, abduction, adduction, and rotation. The best example of this type of joint is the carpometacarpal joint of the thumb. We go next to the functional classification, and they focuses more on how much that joint can move. So there are 3 classifications. You have the synarthrosis, diarthrosis, and the amphiarthrosis. The bones that make up your head are made of non-moving joints called synarthrosis. You have bones that are slightly movable, and these are called amphiarthrosis joints. Joints like the symphysis pubis, and this joint exists mainly to absorb shock during walking and running, as well as move apart during childbirth. And finally, the diarthrosis, which are freely movable joints, like your classic knee and elbow joints. So take note, these are all the types of synovial joints along with their examples. And here is a summary of all the classification of the joints. The only gomphoses in the human body are the joints between the teeth and the sockets or the alveoli of the mandible and the maxillae. Ligaments. These are short band of tough, flexible fibrous connective tissue which connects 2 bones or cartilages or hold together a joint. Ligaments are composed of dense bundles of collagen fibers and are unstretchable under normal conditions. Examples would be the iliofemoral ligament of the hip joint and the collateral ligaments of the elbow joint. These are also largely of elastic tissues and can therefore regain its original length after stretching. Examples would be the ligamentum flavum of the vertebral column and the calcaneonavicular ligament of the foot. A bursa is a lubricating device consisting of a closed fibrous sac lined with a delicate smooth membrane. Its walls are separated by a film of viscous fluid. Bursae are found wherever tendons rub against bones, ligaments, or other tendons. This is an example of a bursa, the subacromial bursa, and it's one of many in your body. Think of bursas like a sock. When you're wearing a leather shoe, the sock helps by reducing friction and prevents pain while walking. Similarly, a bursa ensures protection between the shearing forces as the body part moves, which then helps dampen friction and makes movement painless and fluid. Now this is a special kind of bursa, the synovial sheath. A synovial sheath is a tubular bursa that surrounds a tendon, and the tendon invaginates the bursa from one side so that the tendon becomes suspended within the bursa by a mesotendon. The mesotendon enables blood vessels to enter the tendon along its course. In certain situations, when the range of movement is very extensive, such as in the fingers, the mesotendon disappears or remains in the form of a narrow thread called the vincula. Blood vessels. The arteries are the blood vessels that deliver oxygen-rich blood from the heart to the tissues of the body. The largest artery in the human body is the aorta. The veins are blood vessels that carry blood towards the heart, and most veins carry deoxygenated blood from the tissues back to the heart. Exemptions are the pulmonary and the umbilical veins, both of which carry oxygenated blood to the heart. Here are different types of blood vessels and their methods of union. An anastomosis happens when a branch of artery joins another. Letter A shows you an anastomosis between the branches of the superior mesenteric artery found in the small intestines. Arteriovenous anastomosis or AVAs are direct connections between small arteries and small veins without the intervention of capillaries. Anatomic end arteries are vessels whose terminal branches do not anastomose with the branches of arteries supplying adjacent areas, while functional end arteries are vessels whose terminal branches do anastomose with those of adjacent arteries, but the caliber of the anastomosis is insufficient to keep the tissue alive should one of the arteries be blocked. Sinusoids are low-pressure vascular channels that resemble capillaries. They are thin-walled blood vessels, but they have an irregular cross diameter and are wider than capillaries. They are found in the bone marrow, the spleen, the liver, and some endocrine glands. The lymphatic system is a network of vessels through which lymph drains from the tissues into the blood. Your lymphatic system is part of your immune system and has many functions. They include protecting your body from illness-causing invaders, maintaining body fluid levels, absorbing digestive tract fats, and removing cellular waste. The lymphatic system consists of lymphatic tissues and lymphatic vessels. Lymphatic tissues are rich in lymphocyte and accessory cells such as macrophages and reticular cells. The lymphatic tissue includes the lymph nodes, nodules, spleen, tonsils, adenoids, and the thymus, an organ in the chest that is particularly large during infancy. Lymphatic vessels are tubes, kind of like tunnels, that assist the cardiovascular system in the removal of tissue fluid from the tissue spaces of the body, the vessels, and then return them to the blood. This is how lymphatic vessels are integrated into the cardiovascular system. Also remember that majority of the lymph coming from the head or half of the head and chest as well as the right upper extremity drains into the right lymphatic duct, and all the others drain into the thoracic duct to go into the heart, and lymph is once again circulated in the body. Alright, give yourself a break, do not procrastinate. If you start procrastinating now, mahagbong sa gross anatomy. Nang hadlok. Alright, so what is this type of joint? This is known as gymphosis. So the nervous system is something we will be discussing in neuroscience, a very needed basic foundation in the study of rehab sciences. I'll give you a general overview.
The great and mighty nervous system, or the brain as most of us call it. What makes this organ unique is that within it lies the ability for humans to know oneself. This feature distinguishes and sets the human species apart from the rest of creation. This ability is known as consciousness or intelligence. To begin, let's look at the primary function of the nervous system. The basic purpose is to coordinate all of the activities of the body. It enables the body to respond and adapt to changes that occur both inside and outside the body. Now the nervous system is actually split into two parts: the central nervous system and the peripheral nervous system. We'll explore the peripheral later, but first let's look at the central nervous system. The central nervous system is made up of two major structures: the brain and the spinal cord. As most people know, the brain is found within the cranium or skull, and there are 6 main sections among other structures within it. These 6 sections are the cerebrum, cerebellum, diencephalon, the midbrain, pons, and the medulla oblongata. The first section is the cerebrum. This is the largest section. It's divided into 2 major hemispheres, which are the right and left hemisphere. And the cerebrum is further divided into 4 lobes. These 4 lobes are the frontal, the parietal, the temporal, and the occipital. The frontal lobe is primarily responsible for reasoning and thought. The parietal is primarily responsible for integrating sensory information. The temporal is primarily responsible for processing auditory information from the ears. And the occipital is primarily responsible for processing visual information from the eyes. The second section of the brain is the cerebellum. This is the section located in the back of the head, below the cerebrum, and above the first cervical of the neck. It is responsible for muscle coordination, balance, posture, and muscle tone. The diencephalon section is found between the cerebrum and the midbrain. It contains 2 structures: the thalamus and the hypothalamus. The thalamus behaves much like a relay station and directs sensory impulses to the cerebrum. And the hypothalamus controls and regulates autonomic nervous system functions such as temperature, appetite, water balance, sleep, and blood vessel constriction and dilation. The hypothalamus also plays a role in the emotions such as anger, fear, pleasure, pain, and affection. The midbrain section is located below the cerebrum at the top of the brainstem. It is responsible for certain eye and auditory reflexes. The pons is located below the midbrain and in the brainstem. It is responsible for certain reflex actions such as chewing, tasting, and saliva production. And the last section is the medulla oblongata. It's the lowest part of the brainstem, and it connects with the spinal cord and is responsible for regulating heart and blood vessel function, digestion, respiration, swallowing, coughing, sneezing, and blood pressure. It's also known as the center for respiration. Now that we've covered the brain, let's take a look at the other half of the central nervous system, the spinal cord. The spinal cord is the link between the brain and the nerves and the rest of the body. The spinal cord is divided into 4 different regions: the cervical, thoracic, lumbar, and the afferent and efferent spinal nerves, which merge to form the peripheral nerves. The afferent spinal nerves are responsible for carrying information from the body to the brain. And the efferent spinal nerves are responsible for carrying information from the brain to the body. Now, within this elaborate system of nerves, neurons, and dendrites, there is a system that regulates the functions of the central nervous system, which lie outside its major components such as the brain and the spinal cord. This system is known as the peripheral nervous system and is subdivided into 2 smaller systems: the somatic system and the autonomic nervous system. The somatic nervous system is responsible for carrying motor and sensory information both to and from the central nervous system. This system is made up of nerves that connect to the skin, sensory organs, and all skeletal muscles. The somatic system is also responsible for nearly all voluntary muscle movements, as well as for processing sensory information that arrives via external stimuli including hearing, touch, and sight. The structures that allow this communication to happen between the nerves throughout the body and the central nervous system are known as the afferent sensory neurons and the efferent motor neurons. Now, afferent simply means conducting inward, and efferent means conducting outward. So just like in the spinal nerves, the afferent neurons take information from the nerves to the central nervous system, and the efferent neurons take information from the central nervous system to the muscle fibers throughout the body. The autonomic nervous system is further divided into the sympathetic nervous system and the parasympathetic nervous system. The sympathetic nervous system is vital to our survival. Have you ever heard of the fight or flight response to danger? The sympathetic nervous system revs up the body when confronted with imminent danger to either defend yourself or to escape the threat. The parasympathetic nervous system is the counterbalance to the sympathetic response to danger, whether real or imagined. Once the threat is gone, the parasympathetic brings all the systems of the body back to normal. Now at this point, you should have a basic understanding of the nervous system, but let's do a quick recap. The basic purpose of the nervous system is to coordinate all the activities of the body. It enables the body to respond and adapt to changes that occur both inside and outside the body. The two major parts to the nervous system are the central nervous system and the peripheral nervous system. The central nervous system is also divided into two major structures, the brain and the spinal cord. The brain is found within the skull or cranium, and it is made up of 6 main sections. These 6 sections are the cerebrum, cerebellum, diencephalon, the midbrain, pons, and the medulla oblongata. The other half of the central nervous system is the spinal cord, and the spinal cord is the link between the brain and the nerves and the rest of your body. The spinal cord is divided into 4 different regions: the cervical, thoracic, lumbar, and afferent and efferent spinal nerves, which merge to form the peripheral nerves. Now that we know the brain and spinal cord primarily make up the central nervous system, let's look at the peripheral nervous system. The peripheral nervous system is essentially the nervous system outside of the brain and spinal cord. The peripheral nervous system is then subdivided into 2 smaller systems called the somatic nervous system and the autonomic nervous system. So, as you can see, the nervous system is quite complex, and this is just the tip of the iceberg. Thanks for watching. Look for more videos on the nervous system at cteskills.com.
Membranes. We have 2 types. We have the serous and the mucous. The mucous membrane is the name given to the lining of organ or passages that communicate with the surface of the body, while serous membranes line the cavities of the trunk and are reflected onto the mobile surfaces or viscera lying within these cavities. So it's inside. Mucous membranes may or may not secrete mucus on its surface, but for example, your nasal mucosa secretes mucus, sipon. Serous membranes consist of smooth layers of mesothelium supported by a thin layer of connective tissue. So in this case, you have the pericardium of the heart, the pleura of the lungs, and the peritoneum of the abdominal cavity. An example of your mucous membrane is your respiratory and the digestive tracts. Now we are finally in our last topic, the bone. Bone is a living tissue capable of changing its structure as a result of the stresses to which it is subjected. So you can learn or you will learn to observe in the later topics how a bone changes its structure to accommodate the stresses in life. So, sino ngayon ang nag-a-adjust? So, bone has protective functions in the skull, and the vertebral column, for example, protects the brain and the spinal cord from other injuries. So, the sternum and the ribs protect the thoracic and the upper abdominal viscera. It serves as a lever, as seen in the long bones of the other limbs, and as an important storage area for calcium salts. And it houses and protects within its cavities the delicate blood-forming bone marrow. Bone exists in two forms, compact and cancellous. A compact bone appears as a solid mass, while a cancellous bone consists of branching networks of trabeculae. The trabeculae are arranged in such a manner as to resist the stresses and strains to which the bone is exposed. If you think about this, it's similar to a hollow block or a concrete block, whichever you want. The outer portion is compact while the inner aspect is hollow. That's the physics behind it. Na ako i-share kadit lang. Na-google kog concrete block niya. Naa na daingon ani. Terracotta concrete block daw na. Sorry na ihas inyong doktor. The bones of the human skeleton are divided in two groups, the appendicular and the axial skeleton. The axial skeleton includes all the bones along the body's long axis. It includes the bones that form the skull, laryngeal skeleton, vertebral column, and thoracic cage. The appendicular skeleton includes all the bones that form the upper and the lower limbs, and the shoulder and the pelvic girdles. The bones of the appendicular skeleton, or the limbs and the girdles, append or attaches to the axial skeleton. There are two classifications of bones. You have the regional classification and one that is according to their general shape. So we go regional classification. There are total of 206 bones in the body, and this is a table in Snell's that you can find the total axial skeleton and the total appendicular skeleton. So we go next to the general shape. So the bones are grouped as follows based on their general shape: long bones, short bones, flat bones, irregular bones, and sesamoid bones. We will tackle them one by one. Long bones are hard, dense bones that provide strength, structure, and mobility. The thigh bone or the femur is a long bone, and a long bone has a shaft and two ends. Long bones are found in the limbs such as the humerus, the femur, the metacarpals, metatarsals, and phalanges, and their length is greater than their breadth. They have a tubular shaft, the diaphysis, and usually an epiphysis at each end. During the growing phase, the diaphysis is separated from the epiphysis by an epiphyseal cartilage, and the part of the diaphysis that lies adjacent to the epiphyseal cartilage is called the metaphysis. The shaft has a central marrow cavity containing bone marrow, and the outer part of the shaft is composed of a compact bone that is covered by connective tissue sheets called as periosteum. The ends of the long bones are composed of cancellous bone surrounded by a thin layer of compact bone, and these articular surfaces of the ends of the bones are covered by hyaline cartilage called articular cartilage. Short bones are found in the hand and foot, examples the scaphoid, lunate, talus, and calcaneum. They are roughly cuboidal in shape and are composed of cancellous bone surrounded by a thin layer of compact bone, and short bones are covered with periosteum, and the articular surfaces are covered by hyaline cartilage. Flat bones are formed in the vault of the skull, example the frontal and the parietal bones, and they are composed of thin inner and outer layers of compact bone, the tables, separated by a layer of cancellous bone, the diplo. The scapula, although irregular, are included in this group. Irregular bones include those not assigned to the previous groups. the bones of the skulls, the vertebra, and the pelvic bones. So they are composed of a thin shell of compact bone with an interior made out of cancellous bone. Sesamoid bones are small nodules of bone that are found in certain tendons where they rub over bony surfaces. The greater part of the sesamoid bone is buried in the tendon, and the free surface is covered with cartilage. The largest sesamoid bone is the patella, which is located in the tendon of the quadriceps femoris. Other examples are found in the tendons of the flexor pollicis brevis and the flexor hallucis brevis, and the function of a sesamoid bone is to reduce friction. So another example would be the pisiform bone, which is an attachment or an insertion of your flexor carpi ulnaris. The surfaces of the bone shows various markings or irregularities, and these surface markings aren't visible at birth, but they grow and become progressively more obvious when you physically mature. An example of bone adjusting to physical stresses, as I mentioned a while ago. Some names given to the surface markings differ by either shape, size, or depth, or how it looks. For example, a line is a small elevation, but a ridge is a large one of size, while a crest is an example of a shape. Another example would be the depressions. So these are additional definitions for the surface features of the skull. You have a canal or a meatus, you have processes, you have sinuses, you have foramens, and you have fissures. These are the surface features of the femur. You have the trochanter, the neck, and the facets. You have the head, the tubercle, what a sulcus looks like, tuberosity, diaphysis, a trochlea, and a condyle. And for the pelvis, you have the crest, the fossa, a line, a spine, or a ramus. Alright, so this is the last topic, cartilage. So cartilage is a resilient and smooth elastic tissue, a rubber-like padding that covers and protects the ends of the long bones at the joints and nerves, and is structurally a component of the rib cage, the ear, the nose, and the bronchial tubes. You also have the intervertebral discs and many other body components. Except on the exposed surfaces in the joints, a fibrous membrane called the perichondrium covers the cartilage. So you have three types of cartilage. You have the hyaline cartilage, which is the second most flexible, the fibrocartilage, which is the least flexible, and the elastic cartilage, which is the most flexible. Here is a summary of the characteristics of each cartilage. The hyaline cartilage consists of amorphous matrix, and throughout childhood and adolescence, it plays an important role in the growth in length of long bones. It has a great resistance to wear and covers the articular surfaces of nearly all synovial joints. The hyaline cartilage is incapable of repair when fractured, and the defects is filled with a fibrous tissue instead. The fibrocartilage has many collagen fibers embedded in a small amount of matrix and is found in the disc within the joints. Example would be the temporomandibular joints, the sternoclavicular joints, and the knee joint, and on the articular surfaces of the clavicle and the mandible. Fibrocartilage, if damaged, repairs itself slowly in a manner similar to fibrous tissue elsewhere. Joint discs have a poor blood supply and therefore do not repair themselves when they damaged. The elastic cartilage possesses large numbers of elastic fibers embedded in the matrix. As would be expected, it is flexible and is found in the auricles of the ear, the external auditory meatus, the auditory tube, the epiglottis. The elastic cartilage, if damaged, repairs itself with fibrous tissue. Alright, I know that was super lengthy and hugely on the boring side, but one more tip, when you study anatomy, look at pictures, Google them if you think the pictures you have are not enough, and look at the pictures as you read through the text. You'll understand it better that way. Anatomy is more on memorization, so get those nerve cells functioning. Thank you.